Welcome back to the program. Dr. Femi Ojo is still on the program for us, talking to us about asthma. Right, let's continue with this conversation. Now, we talked about going to the doctors, to diagnose, what could be really wrong with a patient presenting with all these symptoms. But we also know that there are so many other respiratory conditions that could, mask, an asthmatic condition, such as bronchitis and chronic obstructive pulmonary disease. What differentiates asthma from the others?
There are a number of things that can mimic asthma. Just like you rightly said, we have acute bronchitis, which just means infection of the airway, which is part of the lungs, which is supposed to occur for a short period of time, unlike asthma that is lifelong. For chronic obstructive pulmonary disease, this has to do with the inflammation of the airway and the lungs as well. But this occurs as a result of long-term smoking, unlike asthma, in which case you don't have to be a smoker before you develop asthma. But the diagnosis is left for the doctor to be made.
Right. Okay. For our viewers, if you do want to call into this program to talk about this asthma condition, the number to call should be on your screen in about some seconds from now. 080-805-42233. If you want to call into the program to speak to the doctor or ask your questions about asthma, you can call 080-805-42233. As someone has just called in, we can have your question, please. We have a call on the line. Go ahead.
My name is Charles.
Welcome.
I want to ask a simple question from the doctor.
Okay.
If you feel a chest pain in your heart during raining season, your heart is like a hook that it pins you down. Is it an asthma, or what do you suggest? And secondly, if I do exercise or I take a run for like 5 seconds, my heartbeat runs faster than that of the dog. As in, I start breathing like as if I'm not balanced. What do you suggest? Thank you, sir.
Did you get what?
All right, thank you. Yes, if you have chest pain, there are other questions that I would like to ask, to find out where the chest pain is coming from. Chest pain can actually be from the heart, and it can also be from the lungs. But I would like to ask other questions to establish what might be the cause of the chest pain. But the best thing to do is to actually see your doctor as soon as possible, so as to establish the cause of the chest pain and to get adequate treatment. Now, having fast breathing or fast pulse on exercise, it is expected. The body is just trying to adapt or to respond to the exercise at that point in time. You'll discover that after a while, the respiration or the pulse rate, will go down. There's nothing to worry about. But if you think you have some problem with chest pain particularly, you might need to see your doctor to actually get some form of treatment and to know what exactly is causing it.
Okay, I hope you got that, and I hope that answered your questions and, a little solution to what might be troubling you. At what stage of life, does asthma occur? We do know that you've said that it occurs in children as well as adults, but is there, a particular development stage that's, someone can get asthma?
Studies have shown that asthma can occur at any age. We have it in children, we have it in teenagers, we have it in elderly people, so it can occur at any stage. But usually it occurs before the age of 5. About 50% of people, we have reduced symptoms during their teenage years, but of course, it can, the symptoms can actually come back after a while if a patient is exposed to most of the irritants or the triggers that I mentioned earlier on.
Okay, we have another caller. I think Daya is calling from Daya is calling from Lagos. Daya, go ahead with your question. Daya, go ahead with your question. You're on air. I think we lost that call. You were saying? Okay, okay, let's look at some other things now. Like many other diseases, we have cancer and what have you. Many people have said there's a cure for asthma. Is there a cure for asthma?
The answer is no. There's no cure for asthma. But you can manage your asthma and live a normal life. We try to advocate or lay emphasis on early diagnosis with early commencement of treatment. Early treatment is the key to maintaining a normal lifestyle. We have a number of great people who have had asthma or who have asthma that have done well for themselves. We have people like JF Kennedy, Bill Clinton. We have DMX, the popular musician. We have Alex Cooper, the popular musician. We have Alexandra Sean, one of the popular actors. We have, we have Isaiah Thomas, who is an Olympic medalist. Great people who have asthma and that are doing well. So you can actually have asthma and live a normal life once you're on adequate treatment.
Right. Olabisi from Lagos is also calling. Olabisi, you're on air. Go ahead.
Yeah, thank you very much. Good afternoon.
Good afternoon.
Well done. Please, I would like to ask the doctor, as I'm also an asthmatic patient. So I was working in Ikodu, later was moved to Apapa due to the allergic over there. I was returned back. So now I want to ask if this might cost me my job. It being a kind of disease that will stop, the employer to stop me from my work. That's what I want to ask.
Did you get?
It can cost me my job.
Well, I wouldn't know where you're working, but I want to believe that at your place of work there are different departments. If you are being exposed to particular substance in a particular department, maybe you can be moved to another department where you will not be exposed to the irritants or the chemicals that that are actually causing your symptoms. That's what I would suggest.
Right. No, coming from what he has said, it's interesting. I mean, when people are diagnosed with asthma, child or adult, could this determine their career path in life? They should begin to pick and choose what kind of jobs they will do, barring any other environmental factors that can trigger asthma.
What we are trying to advocate for is adequate control. With good control, you can do anything in life, okay? You can live a normal life without even having symptoms for a very long time, okay? So I wouldn't say that asthma should determine the kind of career somebody would, will actually go for, because we're trying to say that you can live a normal life with asthma as long as you're able to comply with the treatments and the medications.
All right, we'll be going on another break right now. When we come back, we'll be looking more at the statistics of asthma here in Nigeria. Do stay with us.